Hi, Steve Adler. You got a minute? We're going to go through the numbers tonight. Just a couple questions that I've been asked to give some answers to. So tonight, not a very long night, but a good night when we look at the numbers. Let's begin with the first dashboard that we always start with. The number of new admissions today, 62. It's been a while since we have been down that low. Takes the 7-day moving average to 70.6. That number was a little bit lower here a day or two ago. We had gone back up. The hope is that we're flattening it out. This would be another indication that maybe that is maybe that could be true. On the right side, you can see number of new cases today, 413. That's below the 7-day moving average of 445. So that's good to see. If we have hospitalizations of July 4th weekend stuff, they should start showing up about tomorrow and for the next week. So we'll keep our eye on that. We look at the 7-day averages of the three key factors down in the mint color. In the center down at the bottom. 7-day moving average hospitalizations, the actual hospitalized tonight is 479. That's down from 492. 479 is still higher than the 7-day running average, so we're still going up, but it's a little closer than it was yesterday. In the ICUs, the 7-day running average, you can see, is 148. In our actual ICUs, 151. Close to the 7-day running average. 151 in our ICUs is a concern. Remember, that's where we're going to show our stress. We get above 200, 225, we're beginning to get real stressed. They can maybe expand it up to 300. All depends on staff. I understand that physicians all around the city have signed up with the Travis County Medical Society on their kind of reserve list. These are doctors that have recently retired or started something else but are available to help. And we should have a registry and a way for nurses that are also retired at this point or available from being able to sign up, just so that we have a list. So if the staffing need really does hit us, we're able to go to that list. I'll keep you abreast of how the nurses can get on it. But anyhow, ICUs, 148 running average, 151 is the number tonight. Ventilators, the 7-day running average is 91, and we have 103 people on our ventilators tonight. Let's go to the next chart. This is the other dashboard on the City of Austin COVID website. You can see the three green numbers in green that I just talked about. The number of new cases we have today, the 413, takes us up to 16,983. Significant number, deaths, 189. 189, that's 10 people have passed away in the last 24 hours. People have asked if it's true, it's sense to them that the number of deaths we have in Austin has been accelerating. The answer to that is yes. But remember, the deaths we're seeing now are probably related to infections that people got 3 weeks to 6 weeks ago, when our behaviors were such that we were screaming into that trajectory, which is why I think we're seeing the numbers going up this way. Those are the two dashboards. The chart from Dr. Escott, which shows us the hospitalizations over time. We're all used to seeing this one. The blue is the actual daily number. You can see how it's gone down here. The last blue mark is down at 62. The yellow is the 7-day running average. You can see how in the beginning of June that number started just going up real fast. and then started leveling off. At this point, we think that's real. The first few data points, you're not sure. It looks like that's real. The only reason that is happening is because people in our city are wearing masks and are social distancing. Not everybody, but more and more people. We can't take our foot off the brake. Right now in the Valley, you can't get in to some of the ICUs. Houston, feeling the same kind of tightness. And we're getting calls from other parts of the state. So let's not squander this. Let's stay really, really focused and disciplined so that we can maintain this. I want to introduce you to a new dashboard. We hinted about it last night. I had gotten kind of a little sneak preview of it, but today we're going to actually go to this dashboard page. It's at the University of Texas. This is the University of Texas COVID-19 Modeling Consortium. This is the group that the Dr. Myers group at the University of Texas. She's doing our modeling for us and been incredibly predictive. Take a look at that number at the top of the page. It's the reproductive number. It is at 0.79, the range. 95% certainty is somewhere between 0.4 and 1.41. Anything below 1 and the virus is going to be dying out over time if we sustain that long enough. Anything above 1, the virus is going to continue to grow. But her estimate at this point is that we're in a place where the epidemic should be declining. It's because we're wearing masks, because we're social distancing, because people are spending more and more time at home. If you look at that second number, the probability of the epidemic is growing 21%, which means there's a 79% chance the epidemic right now is not growing, which is what we're thinking with the numbers we see. Doubling time, we only report that when we're going up in frequency. And the 14-day change, 7% less infections today than 14 days ago because of the behaviors and because of the number of people that are out with the virus. This is a neat website. The site for the website is, you can see there. This is her website. She updates these. The consortium does daily. So here is COVID-19 hospital admissions in our area. You can see the green dots are the reported daily number. The green line is the 7-day running average. If you move your cursor along that line, you can see what the numbers were on any given day. If you go back to where we were when the things started going up in hospitalizations, I think that number looks like to be about June 7th when the numbers started going up. In that area right there, June 7th, if you back up for that 3 weeks, in mid-May, that's when behaviors would have changed to start that going up. And that's about the time there in mid-May that we went from phase 1 to phase 2 on the governor's reopening. But you follow all those numbers. Those green numbers are real numbers. They're reported numbers. And then if you look to the right of that, you can see all the different lines which suggest different alternative futures. Every one of those lines has as much chance of happening as any other single line. But the mean line is the one that you see in the projection. That line, that's the median line. So it's the median of all those lines. And what this shows is, if this is real, if we hit the median, if we're not one of those other possible futures, that's the line that we would see. It would show us basically, leveling off at this point in time. In order to really be able to change the virus load in our city, we need that to start heading down. But this is a big ship, this virus. You can't do that kind of thing overnight. Behaviors now impact things in 3 weeks, so we're going to be stabilized for a while. But if we keep it up, it'll start going down. If it starts going down, then you have greater chance of opening things and keeping them open because the viral load is lower in the city. This is daily hospitalizations. If that other number was the daily admissions, this is the heads in bed count. This is the census count. So instead of being in numbers right now in the 70 range, it shows that our total census is about 500. And again, you can see what the possible futures are. It's these kinds of numbers and these modeling that we're looking at and discussing every day. This is ICU patients is the next one. And you can see same kind of modeling. You can see how that number, several of these models just really take off. That's obviously the concern that we have. If we're in one of those fast growing areas, we do not have the staff to be able to help right now. Hopefully those are low enough percent chance of happening that we're not going to have to deal with those. The kind of the turquoise line off to the right shows you the median projection, and you can see what it is by day by running your cursor over the line. I think those are one more, which relates to the R number that we had at the top when we started off. You can see that when we back in March, we were at a really high R number. People could give the infection to lots of people. We were, hugging everybody that we came across. Then we did the stay at home. The numbers came down. You get into mid-May. We talked about that a second ago. The numbers started going up in our community, peaked in the second week or so in June. That's when we put in the policy about masking, first through businesses and then through individuals. And you can see what the results are. Once again, the people that are walking around saying that masking doesn't make a difference, they don't know what they're talking about. Let's keep that up here. I'm still surprised that there are governors that are not ordering it all over their states. I'm even more surprised at the governors that are stopping their cities from being able to mandate mask use. I appreciate our governor talks about it. I appreciate our governor gave us the ability to make it mandatory. We continue to watch our numbers. I know that some of my colleagues are asking the governor for the ability to go farther in their cities. And I think it's really important that the governor consider giving that to cities so that they can make those individualized determinations. Leaving the numbers for a little bit today, the city of Austin, the Economic Development Department announced a new grant program. It's to support and sustain Austin's child care businesses and centers, providing for support in relation to the impact of COVID-19. This is the Austin Child Care Provider Relief Grant. It's a $1 million fund. Provides grants up to $50,000 for operating expenses for child care providers. The grant program designed to give immediate one-time financial assistance to eligible child care centers, also including family child care home providers would also be eligible to sign up. So please go ahead to do that. The application will be online starting next Tuesday, July 21st at 10 a.m. So we don't have a link to it yet. City of Austin Economic Development or Google Austin Child Care Provider Relief Grant. We'll go ahead and post it too. For information on the application, eligibility required, deadlines, go to atxrecovers.com. You can see it there at the bottom. atxrecovers.com. Application online starting Tuesday. For more information, go there. So take a look now so that you are ready. A couple of questions that I seem to be asked a lot. I'm going to go through. Several people have asked about the transition from stage 4 to stage 5. Can you go back, Anita, to the dashboard number 1? So these are the risk standards that we have. It's green all the way down at the bottom. That's where we can live with a vaccine. Blue is when we get really close to that. That's when we have less than 10 new admissions a day. Yellow, somewhere between 10 and 39 new admissions a day. Stage 4, somewhere between 40 and either 70 to 123. And then above that 70 to 123, we get in the red zone. But several people asked similar question. Ethan Tennyson asked, wasn't stage 5 supposed to be when the 7-day moving average was above 70 new hospitalizations a day? Because we dipped above that. We're above that tonight. Why aren't we in a red zone? Jason Rothman Schoner asks, what's the point in having stages and linking us to a chart if you're not going to follow the stage criteria? All right, so let me explain this. For the transition from blue to yellow and from yellow to orange, it's a specific one single number. When we cross it, we've crossed it. But the transition going from orange to red was more nuanced than that. The concern is that if we entered red when our trajectory was real steep, then we needed to take immediate action to shelter in place or do otherwise, because we were heading at such an extreme that we were going to be well into red and overwhelming our hospitals within a week or 2 weeks. So you can look at that chart and you can see when we crossed from yellow into orange and how fast that line was rising. If it had continued to rise at that rate, then we would have been north of the red stage. We would have been off this chart if we had continued up the trajectory, certainly by the beginning of July. So the question was, when the public was told, and you were told, that that's the trajectory we were on, would we have enough discipline? Would we respond by wearing masks and doing the things that it took? Because if we enter into that 70 to 123 range, but we're doing it at where we're more level. Sure, we're going up, but it's flatter. We don't have to react as fast, because instead of overwhelming here, if we're doing it more slowly, we could be all the way over here before we hit it. It gives us a lot more time to react. That's why they say, why we said on the chart, you go from orange to red somewhere between 70 and 123, depending on the rate of increase you're having at that time. Yesterday, we got lots of questions about how our data would be affected by the Trump administration's new policy of having hospitals bypass the CDC and send all their coronavirus patient information to a central database in Washington. Maria Paz Trippi asks, how is diverting COVID-19 information statewide, nationwide from the CDC going to affect how we obtain our information with which to approach the pandemic? And Lee Marie Kelly asks, where will we get reliable data after this begins to get reported to DC instead of the CDC? And Lillian Neal Aaron asks, what do you expect the numbers to change? How do you expect the numbers to change with the White House taking control of the COVID numbers? Well, the answer to that is that it's not going to, in fact, impact any of the data that you've seen tonight. Because all of the data that you see tonight is data that we obtain locally, we process locally, we collect locally, and we immediately get it out to you. And we've been doing that in as quick and as transparent a way as we possibly can. Again, if you go to either any of these dashboards here in the city of Austin, you can expand some things, you can look at demographics, you can do a lot of nifty functionality in that. Sometime here within the next few days, we're finally going to be able to post the number of ICU beds that are occupied relative to the number of staffed ICU beds that are available. The number of people in hospital beds as compared to the number of staffed hospital beds that exist in our hospitals. Now, the number of staffed hospital beds and staffed ICU beds will go up and down as staff numbers change. More staff comes in, we'd have more staffed beds. Staff had to move away, less staffed beds. So it's going to be dynamic. But by looking at those numbers, that'll give our community just an additional piece of information to stay informed. All of that data comes to us locally. But I will tell you that as data goes to the state, sometimes there's delays in getting it back. I think it's just because there's just so much data. And I am really concerned about the administration taking data away from the CDC and just running it through Health and Human Services. Putting aside any questions about why that policy change happened, what we're told is that the data that goes to the CDC is put up and is publicly available so that researchers and educators and people from the public can take that data and push it and pull it and do everything they want to with that data. It's available to the public. But we also understand when the numbers go to Health and Human Services, the public's not going to have the same real-time access, doctors, scientists, educators. So I'm real concerned about the policy. But I think that's the answers to the questions. I said we'd move a little bit more quickly tonight. I'm going to close. I like this part because I get to talk about kids, which I just really like. It's a hard time to be a kid. I know that. As adults, we spend a lot of time worrying about the kids in our family and the kids in other families and what the crazy effects of all this might be. I choose to believe that our kids are going to be fine. They're having a whole different kind of experience. But I like the pictures where kids are making the best of just having some rough times. I am still blown away by the resilience of these kids all over our city. So here is Everett. Everett is age 5. He has been making homemade pasta. Now, is this an important skill for a 5-year-old to have or not? Probably wouldn't have that skill if we weren't going through the pandemic. But now that we're going through the pandemic, you probably don't make pasta, don't have spaghetti in this household unless Everett is ready to make it for you. Everett is also learning how to ride a bicycle. Here is Everett learning to ride a bike, and I absolutely have to point out the face mask. I think that Everett's PPE game is right on point, and everything about this picture just screams grit, and I'm just trying really, really hard. And yes, you are, and we're really proud of you, and I'm pulling for you, buddy. And with that, good night, y'all. Take care and be safe.